Thank you very much for the two presentations. I'll now open the floor for comments, questions, and as has been the practice, start with the forum members first and then the others.
Thank you very much for your presentations. I have a question for our last speaker. This is really impressive work that you are doing as a response to this increase of neurodevelopmental delays. My question is related to what you said about the fact that we don't know yet the causes. And is this part of the way forward? Because I link it very much to the cost of inaction in terms of prevention through pregnant mothers and even preventing these in girls and women or men if it is related to genetics, biology or environment. So is this part of the way forward? Thank you.
No, we'll take a set of 3 or 4 questions.
Thank you. Chris, the thing I don't like about working with economists is that, no, seriously, the question that I had was, I really liked your idea of testing multiple interventions simultaneously, and also of thinking about the cost of inaction as we test interventions. Could you give us a sense of how that would look in reality? What kind of research projects would you like to be seeing? How do you think that they could be structured or structured differently so that we could get the kind of results that would be more valuable in thinking in these ways?
Yes, this is a question for the last speaker. If you could clarify a little bit more how the budgeting worked in this program and how, for example, the unit costs were defined, and say a little bit more about the budgeting and financing part of this. Thank you.
We'll just do this, Lorraine, and then I'll come this side.
Chris, just a comment. I always find it very inspirational when you talk, because you have the ability with the idea of a cost of inaction to really shake up governments. Because governments are of the thing, well, we'll do nothing, or we'll delay, or we won't do it until tomorrow. And your argument says doing nothing is really costly. It would be great to have numbers on it, and it also would like to know, is it possible, and I don't understand the models, is it possible to say for how long inaction, how do you ratchet up the cost? Because if there's a cost to inaction, if you keep still and don't do nothing for a week, a month, a year, or 10 years, is there an exponential rise in the cost to you? So what is your clawback? And I think those would make very powerful political statements saying, you know, having done nothing, this is the cost to you. But if you continue to do nothing, it's going to get bigger and bigger.
Okay. Oh, yes, yeah, please.
Yeah, this is also for Chris. Chris, I like the baking analogy, and I like the vector of outcome. I wanted to ask you what is in your vector, and in particular, with time differentiation. What would be in it a year from now, 2 years from now, 10 years from now, 20 years from now?
Okay. Pia? After this, I'll give a chance for you to respond, and then we'll take the second round of questions.
Thank you. My question was initially sparked by Lucy's presentation and now Chris. And it's open, actually, if I can pose it to everyone in the room, which is how much information needs to be considered when setting priorities. And I think when Lucy told us the story of her data, at every data point we had to ask another set of questions to get more answers. And Chris, you sort of raised the same thing here, and I'm thinking in terms of investment then, at what point can we say now we have sufficient information to make this investment, or do we have to continue on with the research questions? Can we set a threshold?
Chris?
Okay, thanks. Lots of great questions. I'll try and be quite quick in response. In terms of the sort of types of research that one needs to answer these sorts of questions, I mean, the answer is a lot, and then it's going to come full circle to Pia's question about when can we say that we know enough to make decisions. So I mean, I think there's a number of ways in which the evidence can be improved, and that's starting to look, for example, at combined interventions. So, you know, if we know that certain things are good, but certain things are likely to work much better in combination with other things, then that's one approach to having trials which look at combinations of interventions and them on their own. But that's a very long way round to go. The other alternative is, you know, we have to be very clear that randomized controlled trials, while extremely useful, are also very expensive and actually quite limited. I think we have this view that they are the gold standard of research. Randomized controlled trials only tell you that something worked in some particular place. They work very well for medicine, where there's generally a very clear biological pathway, and you can have an understanding of whether or not that biological pathway will vary by context. But in the types of interventions we're testing, where everything interacts with everything else, they actually don't tell you a great deal. They tell you that that intervention worked in that country at that point in time for those children. That's not a really rich data as it's often made out to be. And actually sometimes the older methods of doing the econometric work, the statistical work to try and unpack the relationships a little bit more is actually a much more useful approach. And also at a point that actually Larry Abrams made in the past in work that we've done, was that also the need to introduce intervention studies which target particular pathways of impact, so that we can start trying to get a better understanding of what exactly is causing it, rather than the very blunt tools which we often use. In terms of the numbers, the same problem applies. I mean, we talk about the cost of inaction framework, but context matters so much that you can only really apply the numbers to one particular case. So in the book that we did on the method, we do have 6 case studies, 3 from Angola and 3 from Rwanda, which put numbers to this and which fill out the vector of outcomes in terms of what we thought was important for those particular interventions. But those are relevant for those countries. And how one does that for other countries is what the point was made this morning, is that you have to repeat that exercise in order that we have the locally relevant information. In terms of what benefits, we like to, it was on the slide, but I didn't have time to mention it. We like to think of 2 sets of outcomes. We talk about what are the sort of constitutive benefits of interventions and the consequential benefits. And the constitutive benefits are really the reason why you go out to do an intervention. So, for example, reducing maternal mortality, the reason you go out to do that is because women shouldn't die giving birth. That's reason enough. That's what constitutes the reason for the intervention. But there are consequential benefits to that which are also valid in the consideration within consideration of how much priority should be accorded to that, which don't take away from the fact that the mother is still the constitutive reason. So there are benefits to her children of the mother surviving. There are benefits that those children will have better education in the future and contribute to the economy. Those are consequential benefits which flow from that intervention. So some way to distinguish between the reason we do it and the long-term outcomes or the short-term outcomes in different fields. And now what you do then in terms of deciding what to include opens up a big debate about how much you can include. And we try to frame our approach as less value-based, but in fact it's very value-based, because we have to decide what goes into that vector. What is legitimate to consider when looking at outcomes? And that's actually a bigger question, and I think one which would take some debate to think about who should be deciding what is relevant when evaluating whether or not one intervention is better than the other. And then finally, to get to touch on the point of when is there enough information. When, you know, this is a question I battle with myself, because I mean, I would say that, you know, there's been enough information for a long time. We know what to do. I mean, people have been bringing up children for quite a long time. It's been going on a while. And they generally have figured it out quite well. And, you know, there are countries in this world that have, you know, infant mortality rates of 1.6 and have very little or no stunting due to nutritional reasons and have very good child development. We know what to do. That's not the question. The question is, do we do it, do we know how to do it cheaply enough for those who control the purse strings to be happy to spend that money? If we were able to give the resources, if we were willing to spend what it took, we could have dealt with this problem generations ago. This is not a difficult question, how to raise children. The question is, we believe it's valuable, others do not believe it is as valuable as we do, therefore we have to find a way to package it in a cheap form which would allow them to feel comfortable to spend the money to do that. And that then can be addressed in two ways. We can improve the information, or we can change or try to change the values of those making the decisions. And so that's where the framing of that information becomes key. How can we get those who control the purse strings to think in the same ways that we do, so that they have a similar valuing for that? Because, it's almost, not to, our dear friend Karl Marx made many mistakes in his thinking, but, he talked about the opiate of the masses being the church, but in many ways it's now us, the social scientists. We're trying to find the interventions which are cheap enough to keep those who are oppressed happy enough that they don't do anything radical.
So, for my first question, I'd like to say that this is really our program. We didn't really expect that so many children would be coming to the child development centers. But then the 2013 survey really opened our eyes to the problem that it's a huge problem, because Bangladeshi mothers or fathers, they were ignorant. They thought that this was due to some, supernatural thing, or that this and that. But now people are coming up. So prevention approach is also in our mind. Our programs are set for 5 years. The current program is going to end in 2016. And already we have designed, I showed you in my slide, that home visits and positive parenting programs we are already thinking about to prevent this. Prevention is, of course, in our minds. Thank you. And for the other part, the budgeting part, it's a bit complicated. These sort of program, we have developed this program approach in Bangladesh. We left the projectile approach. So the program approach now runs by the pool fund under the development part of our budget. The pool fund, all the donors, they give their money in the pool fund. We spend the money from our government side, then they reimburse. And so when they reimburse, we have to go through our Accountant General office, following all our government financial rules, and that takes time and a lot of red tape activity. But we also have an option of direct project aid. If someone is willing just directly to aid the projects, we have one program right now run by UNICEF. It is the Women Friendly Hospital Initiative. They are directly giving us the fund, and we are giving the SOE to them, not through the government process. So that makes it easier. That's why I told you that we are looking for some more direct donors who can fund us directly, and so we can just be accountable to them rather than going through the red tape of our. It's a huge process. So what happens is in July we give our fund request, and we get the fund in September, October. It's not the donor's fault, it's our fault. The government machinery works like that. So we are trying to solve these issues, but it's going to be hard. So thank you. I hope I answered your question. Did I? Could I satisfy you, or you have to go through our budgeting then?
All right, I'll open it to the second round of questions.
Thanks for the contributions. One of the things we haven't talked about today, I know Chris has some experience with, and that's the potential of simulation models to guide investments. So there are simulation models in many other areas of policy that might help us make hard choices under certain assumptions. And anybody on the panel, but I know Chris has thought about this especially, do you think that simulation models that are built up off longitudinal developmental data but then allow you to model the potential impact of different types of interventions, and this, I'd love you to in part address this in the context of what random assignment evaluations do and don't do. So random assignment evaluations might be able to provide an existence proof about what could happen, but not necessarily then help you simulate what, if at different levels of intensity and efficiency, you could make that happen at scale, what the returns on it would be.
Okay, at the back, Adarsh.
I think we've been talking about the investment, so I want to raise three things. One, the funds are at time allocated, but there is such a financial flow of the funds is not following any discipline or any regulated process, with a result many funds, even in the developing countries, whether internal funds or given by the developmental agencies, remain unutilized. And I think this particular thing has to be flagged, that the investment need to be really backed up with good financial discipline. Secondly, what I want to say is that whenever there is a crunch of funds and there is a deficit, the children's program and the ECD programs are the first one which really gets their allocations cut. And I think there should be some kind of non-negotiable policy that children's childhood never comes back, and at least in the social sector, anything where children are involved, this kind of funds should not be really cut. These are 2 points, and I think I had one more point. Yes, when we are talking of the result framework, I think normally the targets are only fiscal or physical in terms of achievement of any intervention which takes place. We never have really had the qualitative indicators which could really point to the right kind of outcomes, which really has to be based on very strong research, input, tools and everything. So I think the whole exercise of investment and result framework must be backed up with a robust kind of research investment so that we could really get the right kind of. Thank you.
Okay, you want to answer?
Sure. On simulation models, I think simulation models can actually be very useful, but also we have to be careful about how useful they can be and what they can be useful for. So I'm a fan of them. I mean, I'm trying to build one at the moment for looking at what is the impact of adult HIV for affected children. And it's an extremely difficult task for child development because, as the cake analogy was trying to say, it's a lot to do with what else is there, how things interact with one another. So building a model is incredibly complex task to try and get that down to a simple enough level that one can understand it in the model. But what I found helpful is a frame for understanding that, is to say that the modeling process can be used for 2 purposes, and the balance between those 2 purposes is perhaps key. It can be used to try and predict the future, and it can be used to try and understand the present better. And I don't think we're at the point in understanding of child development that we are very good at predicting the future yet. I think we can work towards that, but we're not very good at that. But trying to build models around child development forces us to interrogate the present in a much more detailed way, and forces us to re-examine the data that we have in a different way, and I think helps us understand the present much better. And I think that can help inform policy discussions and research priorities much more in many ways than any prediction could. And it forces us to ask more of randomized control trials, for example. It asks us, we don't want to know whether the one arm worked versus the other arm. We want to know, for whom did it work? Did it work a lot for some people, or did it work a little bit for everybody? Once you start trying to model, you have to be very specific about what you're saying. And so we have to reanalyze that data. And it also wants to say, will that impact be sustained? And I heard that Saving Brains is here, and they're revisiting some of these cohorts in the future and saying, well, what's happening over the longer term? What other outcomes are occurring? Does this thing hold? It forces us to ask a lot more, because we need that information if we're going to look at the model. So I think it's very interesting, but we have to be clear for what purpose. On the issue of funds and financial discipline, I think it's a critical point. And perhaps for me, one of the most depressing around the issue of child development, because you see these programs, $5 million programs, and if ever you visited, I don't know whether it's different in India, if you go to many African countries, you find a $5 million program that goes through organization X, can replace that with any name of organization. You get to the ground and it's delivered by volunteers and involves no direct resource transfer to any family, any community at all. All of that money is eaten between head office, regional office, and some paid for supervisor who comes to check on what the poor person is doing for the other poor person. For some reason, when you're poor, you have an obligation to other poor people, but when you're rich, you don't have any obligation to poor people. You can leave them to their own devices. But we expect these services to be delivered free at that point, and we're not prepared to push the resources all the way down to that level. So the funding flows get stuck. And so we need to really think about ways in which that funding can get all the way through. And finally, on the sort of first to be chopped of child programs, what we have to think about is the people who are chopping them are people too. So what is their thought process that goes through, what is their understanding of child development that says that's where we cut, and why do we disagree, and how can we get them to see the light, how can we pull them to our side, how do we get them to understand that it's not a negotiable. But we have to understand what they are thinking about it now, and I don't have an answer to that, but that's perhaps the question we should be asking.
Sure, please.
I want to add some points to that actually all public programs, they somehow reflect the political commitment of that present political regime who are ruling. But if it's for the betterment, then it continues. If people understand, if you can just make people believe that it's for the betterment of their children, then it goes on. And about the accountability in Bangladesh, there is very strict nowadays. The donors have introduced disbursement of accelerated achievements of results. We get funds only after we fulfill those achievements of the result framework. So accountability, I think we are trying to ensure as much as possible. Thank you.
Yeah, there's a question at the back.
Sorry, it's really not a question but a comment, I think. What I wanted to say here is, like, in case when we are talking about financing investments in children, in case of India, at least I can say that we do not even have the data for financing for healthcare, which is as back as 2004-05. For children, it is even worse. So I think in order to know how much we need, the question that was raised by one of the speakers, the most important thing for us to know first is, where is the money coming from, how it is managed, and what are we spending it on? So all those questions are primary to understanding. So a lot of investments from the private or the public sector needs to go in for this. Thank you.
Have more specific sessions on the governance side, because this problem of actually it's not a lack of money in many places. In many places it is, but it's a lack of that money getting to where it's supposed to be. It's not getting to the child, it's not getting to family support services. And I think always really when we're talking about financing, we do need to be talking about governance issues as well. It's absolutely critical. I would just like to also add a very randomized control trial story, which is looking at the 6 to 8 age group, actually, which we haven't talked about so far. And we had a program which demanded a randomized control trial in a very, very short time period. So we were not doing this because we knew it was premature to do a study like that. But it was insisted upon, so it went ahead. Showed results that basically, this was in Kenya and Uganda, and showed results that the Kenya program wasn't doing very well and the Uganda program was doing very well, which was completely counterintuitive for us. We knew that actually the Kenya program was doing extremely well. Then about 6 months later, it was extraordinarily expensive, this RCT. And then about 6 months later, we had a couple of qualitative researchers and ECD specialists go in and unpack a lot of what was going on. And that was where we got the learning from. Since then, it has been ready to have a more sophisticated look at it. And I mean, sure enough, surprise, surprise, as the program became embedded, we were getting the results that we were. And that's another piece we need to be very careful of with our research studies, the timing of it. Let's do it when there's actually something that we should be looking at, rather than, oh, well, we've only got to do a grant, so we've got to see if you've waved a magic wand and changed the world. Well, what a waste of money that is. Thank you.
Yeah.
I'm Pradyumna from UNICEF. Thank you for the nice presentations, and we have been hearing from the very from today that very interesting discussions going on. What I would like to hear from you, is it important to kind of prioritize and package the interventions? For example, the early childhood itself is from pregnancy to 8 years, so it's a long range. So can we kind of phase or package the intervention as the specific need of different phases? Pregnancy to 2 years, we all know that that is the most critical period of life, which have major long-term consequences. So can we package the ECD interventions? Pregnancy, what are the sectors? 2 years, what are the sectors? And then what are the other to 8 years? So can we kind of prioritize the interventions as per the specific needs? Thank you.
I think it's important to package the intervention. What we have to continue to remember, though, is the single point that changes a child's life, so that we have to be having continuity of services over the life course, from adolescence to the early primary. That's what really early childhood development is about. Something Carolyn said. So much of our research is impact evaluations without a real understanding of implementation issues. And I think as a community we have to continue to stand for a requirement that we've got to do as implement it, so that we understand why we're getting the results we're getting. And that we can't be held responsible for development 5 years after the intervention ends, after that intervention. And I think we're at risk of having that happen when we expect long-term outcomes of a single year of intervention.
I think this speaks to the point I was trying to make earlier, is that we have to be very careful not to portray interventions for children in as cheap. It's not cheap to bring up a child anywhere, and children are expensive. What the research shows, you have high marginal returns to your investments for children circumstances. So if you have very little and you get something, you get a big change. Then we start imagining that the fact that we got a big change, that so that it moved in the right direction, that it's enough, that it will on services, additional supports, other things to be in place. This fine line from saying that, with a little bit of resources, with a few resources, we can do a great deal. We need to be able to say that to get the resources flowing. Making the argument that all we need is a little bit of resources. So how do we walk that line between saying, actually we need a lot, but if you give us a little bit for now, we'll make a big difference. And so walking, I find it very back to this issue of framing and back to this issue of governance. Across the messages, I think we are fairly clear what we're trying to say. We're just not very good at saying it very clearly.
About the package system that my colleague you asked, well, we have an essential services package running in Bangladesh. This is like they have some components, communicable disease control, sanitation, hygiene. This is running. But to give emphasis on the MDGs, we have prioritized the child development and EOC, essential obstetric care for the mothers. So just to prioritize, it's better that you have some specific programs too for those who are vulnerable and needing.
Maybe I'll just take a minute for the forum members to think about two related questions that always come up in policy dialogues, especially with the Ministry of Finance. It has to do with this idea of costing, because before you go and say you need so much money, you have to say how much is it going to cost for a child to be provided these services. And what happens, particularly in India, is that yes, you do get some idea of a cost, but then that becomes a national uniform norm that is applied equally across the country. So every child, let me give you a number, we need $100 per year per child. So you multiply it by the number of children and say that, okay, that is some kind of an allocation or target for allocation. But what we lose out in this, and this is extremely important, and we find this consistently in the area of health as well, is that the cost of providing the services vary across geography. So what it is in New Delhi is very different from what it will be in a tribal area. It varies across communities. It varies across the needs of special needs of children. And so that is always left out in these exercises, this rights perspective or an equity perspective. So we really need to think of how to bring that into not just a number and therefore so much per child, but to plan for some differentiated needs-based assessment of costs. The second one, which is again a very practical one, especially in a country like India, where you have the union government mobilizing tax resources, as Mr. Bose said, and allocating it to states. If you have this figure of $100 per child, then some states just don't have the resource mobilization capacity to generate those resources. So how do you ensure some kind of an equalization across states so that the resource poor states also are able to provide some kind of a package with this figure of $100 per child per year? And that brings us into a very tricky area of incentives and performance-based state responses, because in India, for instance, all the implementation of social sector programs, including ECD, etc., is the responsibility of state governments. So while the financing may come partly from the center, there's also this whole issue of the state's contribution and state taking responsibility for implementation. And so how does the central government or the federal government incentivize states so that you don't penalize the non-performing states, because there are lots of serious governance issues. The poor performing states are also ones which have both serious problems of governance and fiscal management and so on and so forth. You don't want to penalize the children in those states, but at the same time you find yourself in this catch-22, but you keep pouring money into those states, you're also not getting the outcomes. So it's a real problem for policymakers and Ministry of Finance people. We still have a couple of minutes to reach 5:30. Yes.
Yes, I just wanted to point out that I think there are different kinds of results-based financing and budgeting, and one is forward-looking budgeting of change in particular per-child outcomes, right? The other is that you are financing based on you don't get reimbursed until you show the actual outcome. And there are quite a few examples of each of these in ECD in various countries around the world, including, I think, some regions that are less represented here, like Latin America. And I think the link from that to the cost of inaction is this tricky thing that is inherent in ECD. In ECD, you have to wait, often a very long time, to find the maximum societal savings. But the rhetoric of the cost of inaction is that the cost of inaction is now. Right now, this is what your society is paying for. And that could actually combine long-term costs with medium and short-term costs in a way that's rhetorically useful, rather than, I think, this inherent problem we have in ECD, which is, well, you're going to find wonderful benefits from investing this amount of your budget in ECD, but it's going to take 18 years to find the effects on high school graduation. It's going to take at least 6, 7, 8 years to find effects on grade retention. So I think the link between these issues, because I think results-based budgeting and finance has a forward-looking kind of temporal aspect to it, as well as one that makes you actually look backward. And those are two really different forms of this, where I think we only heard one example of one type of that. And then I think these two themes in the panel are linked because of the paradox of how long you have to wait for many of the cost savings of ECD to become apparent.
Yeah, that's one question.
Following up on the okay, sorry. And I'd just like to underscore the dilemma as you posed it. Incentive-based budgeting tends to exacerbate differences between regions in a country because the better performing, the ones who are already better performing get more. Now, one alternative, but it is not really widespread, is the idea that a well-performing region or district or jurisdiction gets more autonomy and as an incentive, and has more liberty of spending a certain lump sum of money across sectors, across services, whereas the ones who are ill-performing will be penalized by losing autonomy, and the state, in a matter of speaking, takes over and intervenes more directly and says, here is some money and you have to spend it on those services because this is where you are weak. Maybe that's an alternative, but I can't say it's a very widespread practice.
All right. Sorry, Vinita, last question. It's time over, but last question. And
yeah, I've just been reflecting on outcomes with respect to early childhood development. And the nature of outcomes is much more complex than, say, with education or with health, independently. So when one thinks in terms of the outcomes for early childhood development, they are very interdependent in terms of different sectoral inputs that are going to be responsible for those outcomes. And the financing is always very sectoral. So I mean, there's that dimension of it also, that when we're talking about outcome-based financing, we are talking about accountability, perhaps. We are talking about a reference point against which we finance or don't finance. And who do we hold responsible? Because it is, I think it's a very complex kind of a context in which we have to do this assessment.
good. So that brings us to the end of the session. Let me thank Chris and Ashrafi for two fantastic presentations, and the audience for asking very good questions and making this, since I'm moderating, one of the best sessions of the day. Thank you.